Hi, our poster is about minor health problems that people take to the GP or an emergency department. And we've done a systematic review of what we've termed health literacy interventions that try to reduce the number of visits to these services. And I'll explain that later. Our study was funded by the NIHR, and the views expressed here are ours, not theirs. So health literacy is our ability to find the information we need about health and healthcare, understand that information and take action on that information. And some people struggle to do these things. And interventions are developed in order to improve health literacy and therefore improve how people manage health problems. I personally became interested in this when we undertook some research about why people use emergency departments and general practice for minor health problems. And health literacy is by no means the only issue that people face. It's a complex area with multiple things going on. But there was no doubt that the literature, the systematic review that we did, the primary research that we did identified that health literacy was one of the issues that affected people's use of these services for minor health problems. And it was particularly linked to anxiety. You know, people say that they go to these services with minor health problems because they're anxious. They think they might be serious. Well, why do people think that? And that health literacy might be contributing to that, or a lack of health literacy. And here are some examples of some of the interventions that are used within the NHS at the moment. If we look at the left-hand diagram, this is what we call a navigation tool, helping people to decide which service to use for which type of health problem. The second one is helping people to understand how to manage different health problems. This is the little orange book that was developed up in Newcastle. And you can either click on the website on a particular symptom and read about it, and it also comes in paper format. If you look at the third diagram, this is a service that is aimed at parents of young children, and you can find that in Sheffield Children's Hospital website, and it's very, very similar to the little orange book. And the last diagram there is NHS 111, and it's a symptom checker, and you can put in your specific symptoms and find out what you need to do. Now, a lot of these interventions were not in the evidence base that we found, but I just wanted to show you the relevance of the evidence base to the services available in the NHS at the moment. How do we think these interventions should work? What are the assumptions underlying them? Well, here's a logic model. If you look at the first column, the interventions come in different shapes and sizes. We have different types. They're targeted at different people. They might be targeted at parents of young children or all adults. They might be delivered in different settings. The mechanisms by which they might work include informing people about where to go, educating them about how to look after health problems, trying to relieve the anxiety that they face. The intermediate outcomes we're aiming to enact on, trying to increase health literacy, increase knowledge, change people's intentions about how they will use services. And then finally, those long-term outcomes, reducing the use of ambulance services for minor conditions, emergency departments, GP, and doing all those things safely. We undertook a systematic review with stakeholder meetings around that review, and we looked at the last 30 years. We found 67 studies, 30 of them were randomized controlled trials. The first thing we did was we grouped these interventions into types, and you can see that we found evidence for 7 intervention types, And I've given you an example of a navigation tool directing people to different services. We had written information in booklets and websites about how to manage your minor health problems. We had people delivering the education. So, for example, a practice nurse might deliver it. Then we had combinations of these things, sort of adding to the complexity of the intervention. Written information delivered by a doctor or a nurse. Multi-component interventions where there was written information, it was delivered by a person, and there also would be a mass media campaign around it. And then we also had self-triage interventions. Now, regardless of the type of intervention, 2/3 of these interventions were shown to have worked within the studies, and 1/3 of them were null findings. Not all of them looked at the impact on emergency departments and general practice, but if they did, it was 2/3 were positive, 1/3 not. And we tried to understand why some of these were positive and some not. Was it to do with the quality of the research? Was it to do with the type of intervention? Was it to do with who they were aiming the intervention at? And none of these things explained why some of them worked and some didn't. We were also interested in safety, and only 8 of the studies measured safety. Now, the studies that did found that they were safe, but there weren't a lot of studies looking at that issue. And so that left us with the conclusion that we still needed to be evaluating these interventions, even though they were in common use in the NHS. So does this leave us with the usual systematic review conclusion, oh, more research is needed? There is an element of that about it. Our stakeholders were very, very useful. And the sort of the wider work that we did in this area, apart from the systematic review, or while we were doing the systematic review, and we came up with some guidance around these interventions and the use of these interventions. And they're used a lot in the NHS, and we did look at the readability and how easy it was to use these interventions. Our patient and public collaborators helped us to look at that, and we found some of them were really easy to read and easy to use, and some of them weren't. So it's a good idea to check that any intervention you've got is as easy to read and use as possible. There are a lot of them around. Why develop more? Why not assess the quality of those that are already there and try to use those? Important to think about how to make them as accessible as possible. It's not just that you develop them and evaluate them, but who can use them and make them as accessible to as many people as possible. Ensure that they're available in leaflet as well as digital formats, because digital literacy is actually very poor. Something like 9 million people in this country struggle with digital literacy. How to deal with different languages. A lot of these are available in English only, and we still need to evaluate effectiveness and safety. So thank you for listening, and if you're present in the conference, do go along and have a look at the poster, which has more detail on it.